of kids really aren't interested in a hamburger. It looks good, but they can't eat their way through it. They really are quite weak, so they really get high protein, high caloric meals. Nothing to be wasted. And then support of the family, helping the parents to adjust to how to take care of their child without wrapping the child in bubble wrap. The child still has to be allowed to experience the environment. Okay. Hypoxemia. Okay, hypoxemia. We're looking at just how much oxygen is flowing through the blood. Hypoxia is telling you that the tissue doesn't appreciate the lack of what it's getting. So when we're looking at the kid itself, is the tissue suffering? Turning blue, you have to be careful about the blue part, etc. Infants will turn blue if they're cold, period. But the cyanosis that we're looking at is the overall circummoral, not just fingers and toes, face. They have to saturate a whole lot of blood. So cyanosis is a late sign. If you wait till they turn blue, you wasted too much time. This child's now in deep trouble. Polycythemia is another problem. When the body doesn't see enough oxygen, it makes an assumption that there may not be enough red cells, and so it may start producing more red cells, which gets a little sick, a little problematic. And then the clubbing that we see for the children that are chronically running into hypoxemia or becoming hypoxic. If they're very young, the infant, we're going to give them prostaglandin E help, particularly as one of the cardiac problems that's going on itself, because the blood flow is wrong on their structure. So when they give vitamins or prostaglandin E, there's vasodilatation. It's a lot easier for the heart to move blood through, etc. You can do this some of the infants. 100%. You usually don't get them 100% to neonates, because that's really hard on their eyes, the retina. But when they can turn really, really blue, they're going to get 100%. The knee chest position, which I believe I have a picture of that, show you, is basically we fold their knees up, etc., which is helping with the blood return. You basically kind of fold them. Morphine. Why morphine?
Pain and decreased respiratory.
Yeah, a little slow down a little bit. Now look, you say it's for hypoxemia. Same reason why we give morphine to someone who's having a heart attack, like Demerol or anything else, morphine. It has the effect of, besides the euphoria, see a dog like having a heart attack, but that's okay. It dilates pain. Increases what's known as venous capacity, so that there's not all this congestion going on. And that's only morphine will do that. And then a very calm, comforting approach. All right, knee chest. I knew you were just on that. So you say, well, that's just normal. We don't normally. So this child can't really see it that well. It's still a little blue there. This child has been folded and then held up close. It actually helps with blood return. Okay, nursing care, I've given you this. Family adjusting, education, absolutely. This is can be a long-term problem because of the things going on. Okay, hemodynamics. Okay, going to go through some of the structures that really cause the problem. Those things that increase pulmonary or obstruct, etc. Okay, what's going to increase pulmonary blood flow? That's which blood is going to be basically recirculated back through the lungs. If there's a hole in the atrium, blood from the left side is going to keep moving back to the right side and going through again. Same thing with the ventricle. And then the patent ductus, if it's still patent, which it shouldn't be, blood is going to come up and escape through the patent ductus out into circulation. So, I gave you these pictures, and you have them in your book. So, atrial septal, there's this lovely hole that's here, so blood is moving through. And as time moves on, because blood keeps coming back to the right side, you're going to have the right atrium and ventricle becoming enlarged. They don't become enlarged with muscle. They just simply stretch. So now it's going to be more dysfunctional rather than healthy. We do hear a murmur. And what they do is they'll close it. They can put a patch over that as long as it's, they look at the patch. It says asymptomatic. They don't show this. I took care of a guy in his 20s. He had it, and it was picked up when he was in the military, and they patched it in his 20s. By that time, his lungs had already been destroyed, and they patched it, it basically killed him. Okay, ventricular, same thing. Increased pulmonary, blood keeps coming back and going back to the lungs again. Now, the shunting depends on how large this defect is. They're going to go on heart failure because they are really being worked. They don't gain weight, and you can hear this almost without stethoscope. All right, your patent ductus. Continuous machine-type murmuring, and it's a very distinctive type because the blood is supposed to be going out to the lungs. Instead, what is the higher pressure? The higher pressure is in the aorta. Not here, not from the right side. The blood is already being pumped out of the left side to the aorta, then it skips on back down here to the lungs again. So, what do they do with that? They can go in and tie it off, or they get one of prostaglandin inhibitor. Now, I just told you about one prostaglandin that expands it. What they do is give the inhibitor to it to close it. They can also put tiny little coils in there and kind of create enough stress that the blood can't get through that. So, patent ductus. Okay, what's going to decrease pulmonary blood flow when you really want it? There's one, you have to, well, this one is problematic, and atresia is a narrow one. Nice to see, not going to test on it. No, you don't. Try it. This one will be testless. If it's not me, it will definitely be on the test sheet. Tetralogy flow. Tetralogy means 4. Below what somebody means range. What you have are 4 different structural problems. First is a very large ventricular septal defect. So that's problem. Structural defect. Pulmonary valve stenosis. Remember, your pulmonary valve is what blood is, artery is what blood's going through to get to the lungs. If it stenotes, which means it's stiffened, it's closed, it will not open, that means that the blood on the right side of the heart really can't get out into the pulmonary artery and head on to the lung. So that's a problem. The right ventricle over hypertrophy. The right ventricle hypertrophy just means it enlarges. But that doesn't mean it gets muscular, it just gets big, and it can get in the way of what's going on. And then the overriding aorta. So we have look where the aorta is. That is wrong. It's sitting there right as the left atrium is trying to get blood down here to the ventricle, which now is pushing blood over to the right side, which can't get blood into the pulmonary artery. So it takes the next way out to the aorta. You got a question? But that doesn't mean it gets stronger. So what we have then is somebody who really can't get blood into the pulmonary system. They turn really, really blue. And when you look at the heart, picture, it says boot shape, and it is. It's like a boot. That's why they call it wrong, so many things. So a lot of problems with this particular problem. So remember, Chicago gives blood COS. 4 major structural things have happened. They do require surgery. And what we see with these children, they turn blue very quickly after birth. They don't waste time. Bring them all and say, aren't they cute? And then they take a breath and why are you blue? And why are you blue? So you need to check. The older children that still have not had complete fix of it, when they start having the they call it a test cell, you'll see them automatically drop into the squat position. So we have all of those things. There are, and as you can see, it is palliative treatment going on. It's not a, they can only fix it but so far. Okay, coarctation is the other main thing that we see in that's the big one, talking about pediatric treatment. A coarctation means a narrowing. Something coarced is narrowing itself. It's not like a stenosis, which is at where a valve is located and can't move. So narrowing, increase blood flow, which is going to increase pressure in the ventricle, and decrease the cardiac output. How much blood is getting out into the systemic circulation. We have a picture of that in the book. Then this other transposition of great vessels. We need to know that one. The rest of them do exist. The hypoplastic left heart syndrome, basically the left side of the heart does not develop in utero. It's not complete development. It may not develop at all, which means that child will die. The child usually dies before the month is out. Some of them will have underdevelopment of the left ventricle, which means still a lot of problems for the child. There's no such thing as going in there and enlarging it. So those are your transposition. Basically two separate. When you look on this side, you have the right side of the heart. So blood is coming in, but the only exit is this one, and this is the aorta. So the right side empties into the aorta. On the left side, any blood that manages to come in sends blood out and back to the lungs. This is pulmonary artery. So there's two separate parallel circuits. And this may not be picked up fast, but it will be because CDA, what they have to do is, as soon as it is discovered in the nursing, is they got to punch a hole between these. So an emergency is they need to keep that patent ductus open, need to keep it patent, and they need to be sure that there is going to be some connection between the right side and the left side. So that is done as soon as it is discovered in the neonate. And then after that, it's a lot of surgery to switch all of these around. A lot of surgery. So these children spend a lifetime in the hospital. Okay. Other thing that you need, so the structure, let's go back, look at those main structures. The problems that are still common for years in general and need to be taken care of. Okay, the other thing that's there is the acquired. Coming down with something infectious and something very inflammatory. So endocarditis, which you will also get in med-surg, certainly kids get it. There's various ways of getting it. Here are the three main things that will cause it. It tells that the endocardium becomes inflamed. The heart's in a world of trouble because it's going to vegetation color. It's going to get there, it's going to throw emboli, vegetative emboli, part of the bacteria all over the place. It's going to destroy the tissue, et cetera, et cetera. So, anybody that is going to have anything done, adult or otherwise, prophylactic, if they're going for any procedure that's going to possibly have something enter the bloodstream, they have to have antibiotics. And on kids, they're usually put, adults too that have had it, are put on low dose antibiotics for their lifetime in hopes of preventing. There's no such thing as simply going to the dentist for a cleaning. They have to be put on antibiotics for everything. Okay, acute rheumatoid rheumatic disease. This is your strep throat. The untreated strep throat is a real problem because it will go ahead and get you on rheumatic fever. Rheumatic fever inflames the heart, inflames the joint. The chorea is uncoordinated movement, involuntary movement of the arms and legs itself. Take like it's dancing off. First it looks like they're dancing about, and actually they're just trying to walk from point A to point B, but they cannot organize what's going on. If it doesn't, rheumatic fever, it will give them heart disease. And someone already do GU for you? Talked about glomerulonephritis?
Yes.
Okay. That's the other problem. So it destroys the valves in the heart. What do they do? Get rid of it. Eradicate. Prevent. Other treatments, once chorea shows up, it's there forever. But that is damage to the neural system. How they treat it? Well, if we have somebody with strep, tonsillitis, penicillin, they can handle fall for the older kids, fine. So they have to treat it. This bacteria has got to be killed off. Okay, one of the last things I believe is Kawasaki. This is a nasty little thing that shows up and it's nobody's fault, but there's always a concern when you see it. This is its formal name. This is the doctor that named it. Is systemic vasculitis. Imagine every blood vessel you have is inflamed. That's what this is. Dangerous? Oh yeah. 75% of the cases are children under the age of 5. So, self-limiting. If you can take care of the child, it doesn't extend. Once it's there, it's there. The thing is to prevent complications. So imagine having every blood vessel you owe is inflamed. What needs to be done? What are you going to do? Because they're coming to the hospital. I'm sorry. Anti-inflammatory? Actually, they get aspirin about it. But what are you going to do? What do you got a child that has every blood vessel inflamed? What's the care? What's going to be on your nurse care plan? There's anything over there. Something. What was that? They can try doing that. Remember, they're under the age of 5. Like, yeah. But that's not what the nurse does. Nurses. I'm asking you nursing care plan, not medical. Nursing. That's like giving nurses diagnosis, like the plan. What are you going to do? Yep, you look like you are on 5 now. Oh, well, we can work with some cool conference, but I want you to say something else. What else? What else? This is your child. I'm the nurse. Hey, cool conference. Help yourself. Pain management. All righty. You're amazing. Who's in it? All right. Will they be up and playing?
No.
Are we very hungry? Might we bruise very easily or have bleeds? Oh, okay. That's a start. What can you think of? Safety. I like safety. Work with that. Oh, they'll be resting, yes. Keep them bundled. the age where they're usually all over the place. They won't be all over the place for it. So you're worried about a lot of things as a fear. Okay, they don't know why. Self-limiting, so you've got to weigh it out. They're going to give them gamma globulins. Look at this, risk for coronary artery aneurysm. Not like having a 5-year-old having a major blood vessel burst in the heart. So you're going to be watching them for, well, I don't know, cardiac complications? So you want to be sure. These children are not hard to pick up. Remember, every blood vessel just about is inflamed. Look at those eyes. Look at those eyes. Those cheeks. He's not wearing rouge. His ears, his hands. This little one hurts.
Wait, I'm sorry, what was the answer?
Nursing care plan? What are you going to do with the child? I already gave you some big things, but I'm asking as a nurse, what would you be doing?
Monitor cardiac.
Yeah, what's going to show on your care plan for look at those eyes? Now imagine the parent looking at this child and how do they feel about it? Shocked. So you're going to think about somebody whose every blood vessel just about has been compromised. Self-limiting, yes, but meanwhile. Any questions? Vital signs, big vital signs, that doesn't do anything. That's just discussing.